Hi, my name's Anurag Pattekar. Welcome to our social change pitch on respiratory illnesses in young children in Nantong region in China. Our team is J1, and today I'll be going through section 4, which is basically the tools for mapping systems. So the first map that we'll be looking at is the root causes map. Now, when we're mapping out the root causes of respiratory illnesses, the first step is to sort of break down the social issues and remove all of the background noise. This is from RELA 2007. What this does is allows the true root causes of the problem to be identified and allows a wider discussion on the issue. So from the root causes map on the slide here, the key root causes are inextricably linked together as industrial zones, economic policy, and the lack of government enforcement. Now, in order to achieve a healthy environment for these kids to be in, these three root causes must be addressed in a bid to provide clean air, as the pollution of these sources remain the biggest source of mortality to the population, and in particular those kids who are more susceptible to experiencing these illnesses. This is from Zhang et al. 2014. Now, the next map we'll be looking at is the complex issues map. So looking back from our previous root causes map, the three interrelated root causes we chosen to be our main focus were industrial zones, economic policy, and lack of government enforcement. Now, in terms of how the map is actually subdivided into sections, we've put them into a public, private, and not-for-profit sector, and then we've basically established causation links between each of the issues. And then we've also added a positive or negative sign on the link to illustrate whether it's a positive feedback loop or a negative feedback loop. So in terms of complex issues, the most prevalent that we deemed were the increased chronic illnesses and reduced quality of life. This sort of feeds on from poor economic policy of the government in conjunction with a lack of governance from their part, allowing these industries to basically operate and pollute all these different types of chemicals into the atmosphere, causing a myriad of respiratory issues for the children. So our third map is the actor maps. So basically we're identifying individuals and organizations that directly affect and are affected by the young children in the Nantong region. So the actors in the micro and meso system are those people we believe will have the most significant impact in terms of utilizing a bottom-up approach to ensure that institutional changes are made to industries that are polluting these pollutants and essentially are impacting those young kids in the region. This is from Zhang 2014. By encouraging people at the lower levels, changes in the decision-making process can be made right up through to higher levels, ensuring that a positive social outcome is achieved. Our fourth map is a tactical actor map. Basically, we're looking at the tactical relationships between, in our case, a child and an industrial organization. It's been identified which different actors have power over each other in terms of influencing or affecting change. So in terms of the child, it was identified that those with direct impact were those actors. The child would be suffering from ailments, would seek support from either doctors, their family members, potentially school teacher, and then would be able to seek support from them and initiate a bottom-up change. In terms of the organization that's emitting the pollutants, the actors identified those who can affect the top-down change would be various ministers, such as the health minister, environmental minister, and then look at those industries such as environmental emissions control agencies, who can impose restrictions on them in a bid to improve the situation for children in the region. So the last map that we have is a spectrum of collaboration map. So on the left side, we've got our allies. On the right, we've got our opponents or competitors. So the ones on the left, we're looking at allies. So those people who would have a direct impact in making the present situation better for the children. So we've got our local communities, doctors, family, Human Rights Watch, even to an extent the health minister. And as we go towards the passive allies, we start to get a mix of government, private and not-for-profit entities, identifying that certain health organizations would be most influential in terms of driving these positive social outcomes. This was by Gong et al. 2012. And then shifting towards the competitor side, we've got particular financial institutions, industry partners, or organization management. These were identified as entities that had their own agendas where profit margins and bottom lines were the top priorities rather than driving these positive social outcomes.